My name is Sue Rabati, and I'm the founder of MedShadow.
I'm Jonathan Block, and I'm the content manager here at MedShadow.
Thanks for joining us. Jonathan and I wanted to bring to your attention a study on adult onset asthma. It seems that perhaps not all the adults who have been diagnosed with asthma may have asthma, or maybe there seems to be a remission rate. And this is important because right now, asthma is considered a chronic disease. Once diagnosed with asthma, you'll probably be on medicines for it, or it will be on your medical record for life. And why is that a problem, Jonathan?
Well, I'm going to want to go, first of all, back to the study that you were talking about. That was published in the Journal of the American Medical Association. It found that 1 in 3 people that have been diagnosed with asthma actually don't even have asthma. They've been misdiagnosed. Now, why is this a problem? Because overdiagnosis can lead to unnecessary medical treatment, and as the watchers of MedShadow TV know, all medicines have side effects, and you don't want to take a medicine unless you absolutely have to.
There are two issues at hand here. There could be the issue of overdiagnosis, and there could be the issue of remission. So, first, to talk about overdiagnosis. There is no definitive test that says yes, you have asthma, or no, you don't. It's a nuanced disease. A doctor needs to use some judgment in this. There are a couple of standardized tests that can be used, spirometry, and the bronchial challenge are two of them. But the doctor will also consider, most importantly, your symptoms, your personal history, and your family history, and come to a decision. Quite often, if a patient presents or comes in with wheezing, long-term coughing, chest tightness, the doctor will hand the patient an inhaler. And if that inhaler helps to clear up the wheezing or discomfort immediately, that can end up being the diagnosis. And that is a rush to diagnosis.
About 20% of the people that do have asthma, they end up going into remission with asthma. Unfortunately, what also happens is that even though they're in remission, they still may continue to take their oral corticosteroid medication.
So our suggestion is that every so often you go back to your doctor or go to a new doctor and ask for a re-diagnosis, just to check, do you really have asthma, or has it cleared up, or maybe you never really had it and the underlying issue has gone away on its own. The doctor will probably work with you on a plan on how to figure that out, so don't just stop taking medicine. You need to talk to your doctor about this. There were some limits to this study?
Yes, there were. The first limit was that the patients that were included were only followed for 15 months, which is anybody that knows anyone that has asthma is a very short period of time to be looked at for asthma. People who have been taking oral corticosteroids for a long period of time were excluded from the study, which is key. And only about 45% of the people included in this trial, in the study that involved the trial, were actually on an active medication.
If you want more information on asthma or on corticosteroids, please go to our website at www.medshadow.org, where you should find a lot more information. Right, Jonathan?
Exactly.
Thank you.